Hello, everybody, and welcome to this very special webinar brought to you by the Institution of Occupational Safety and Health, or IOSH, as we are more commonly known. My name is Kelly, and I am the president of IOSH, and it is my pleasure to introduce you to our session today dedicated to the impact of digitalisation and AI on worker safety and health. So this webinar is set out in 6 parts, featuring 5 speakers, followed by a panel discussion and an opportunity for all of you to ask any questions. It promises to deliver a genuinely global perspective. Our diverse lineup of speakers is made up from representatives from Kenya, the UK, Canada, and the Gulf Cooperation Council, or GCC. Sadly, our planned speaker from ENSPO, bringing a European perspective, has been unable to join us today. This event takes its cue from last month's 2025 World Day for Safety and Health at Work, and its key theme of the impact of digitalisation and artificial intelligence, or AI, on workers' safety and health. We have online guests signed into this webinar from across the world. It is a real coming together of different time zones. I'm hoping, however, whatever time it is where you are, is that you've managed to get some good night's sleep, undisturbed by any nightmare visions of a world of work taken over by dystopian dreams of AI and digitalisation gone wrong. I must admit, though, that this theme has reminded me of a rather iconic Disney scene from Fantasia. You know, it's the one where Mickey Mouse plays the young apprentice who's been told by the sorcerer to fill the cauldron with water whilst the sorcerer goes on other tasks. The rather overconfident apprentice uses one of his master's best spells to enlist the help of a broomstick in completing the task with the least amount of energy expended on his part. After a productive start, the apprentice falls asleep, only to wake up and find that the cauldron is overflowing, the room is flooded with water, and the broomstick has continued to fetch and carry more and more water. The apprentice hadn't troubled himself to think about how he could use the magic to turn it off, and the broomstick being brought to heel. He panics and attacks the broom, only to create a whole family of brooms that multiply the chaos. Eventually, a rather unimpressed and somewhat angry sorcerer returns to restore order, but the apprentice's credit has been dashed to pieces. So many workers have experienced the effects of intrusive surveillance technology and AI. And there's a prevalent fear that this spiraling out of control, like the broomsticks, without a stronger piece of regulation to protect them. There's danger that modern technologies could lead to widespread discrimination, work intensification, and unfair treatment if left unchecked. The pandemic encouraged significant increase in workplace surveillance technology, it's claimed, as employers moved to more remote forms of work. There were reports of AI-powered technologies even being used to analyze facial expressions, tone of voice, and accents to assess a candidate's suitability for roles. All this leads to calls for statutory duties to consult trade unions before an employer introduces the use of AI and automated decision-making systems, as well as legislation to include the right for workers to disconnect, plus digital rights to improve transparency around the use of surveillance technology. But AI is a strategic technology that offers us many benefits, and not just for us, but the global economy. This includes bringing improvements to working conditions. Robotics, including AI and drones, can make work safer by replacing dangerous activities and intervening in many of the physical jobs that cause higher level of injury, such as when operating in dangerous environments, such as mines, mills, farms, laboratories, factories, and energy plants, for example. AI can also detect if a worker is not wearing suitable PPE and send an alert to prevent access to hazardous areas. In short, AI technology has the potential to change our lives for the better. Yet, it is not a given that AI will work for the benefit of people and be used as a force for good in society. we have work to do, and we have to work at it. So all of us, occupational safety and health, or OSH professionals, HR specialists, designers, employers and workers, we must all come together to give AI technologies a human-centered and ethical focus. It is important that all parties contribute to the implementation stage of AI-driven technology, helping to identify, mitigate, and prevent any unintended consequences. Workers' fundamental rights must be respected, with human dignity, non-discrimination, and the protection of privacy and personal data remaining paramount. If we are concerned about the potential physical and mental harm at work, then we must advocate risk assessment and the ongoing review of new technologies and digital transformation, including AI adoption and man-to-machine communications. We must guard against any inappropriate algorithmic decisions or tracking. But while it is critical that we maximise the many potential occupational safety and health benefits of AI applications, we must also take care to minimise any potential threats. These threats may include, for example, the potential to misuse AI-enabled workplace sensors, leading to tracking of all aspects of worker activity, insufficient collision control, where AI-enabled robotic devices and workers share a physical space, and any lack of clarity on responsibility for AI-enabled decision support systems. And what we must have is regulatory oversight and checks of AI applications at work, including by OSH departments and authorities, sufficient training in OSH assistive and collaborative AI, proper consultation with workers whenever new technologies are integrated at work, applying a worker-centered human in command approach. The adoption of AI technologies must be socially responsible. Before any AI-enabled devices or systems are introduced in the workplace, their risks and benefits must be subject to thorough and transparent review. All parties must consider how AI applications will impact the workforce, local community, supply chain, and anyone else affected by an organisation's activities. This will reduce workers' exposure to serious workplace hazards and ensure risk prevention is designed in from the get-go. If only the sorcerer and Mickey had been as socially responsible. So, without a broomstick in sight, it is my absolute pleasure to introduce you to our first speaker, Dr. James Muthanga, who's Director of NIOSH, who is joining us on behalf of the Directorate of Occupational Safety and Health Services from Kenya. If you do have any apologies, Dr. James is not yet with us, the joys of modern technology. So instead, we will go to Dr. Ivan Williams Jimenez just in a moment. But if you do have any questions that you would like to ask along the way, can I ask you please to add them into the Q&A function button rather than putting in the chat box? It makes things much easier for me to track as we go to the Q&A session later on. I can also tell you before everybody starts worrying that a recording of today's webinar will be made available on the IOSH YouTube channel by the end of this week. So please do look out for that. So now it is over to Dr. Ivan. Thank you.
Thanks, Kelly, for the great introduction and invitation. And of course, congratulations to the ILO team for capturing a wealth of data as part of the World Safety Landmark Report. I think I truly believe the discussions we're having as part of this webinar are really timely, and I'm really looking forward to see other national perspectives. So I've been asked to provide a brief snapshot of some of the developments that are currently happening in the UK. And I think I also tried to end my presentation summarizing IOSH's viewpoint on the subject, but also signposting to some of the materials that we have been published to fit into these debates. In terms of the UK context, and many of our participants might be aware of this, we're currently going through the implementation of the Employment Rights Bill. Ultimately, we'll look at boosting productivity for British workers and grow the economy. But also, it will try to help more people stay in work and improving basically living standards. And I don't think that's that dissimilar from other national perspectives. We definitely seen a strong focus on innovation, economic growth, and that interlinkage with technology advancements and so on. According to UK regulators, this development has been named as the biggest update to workers' rights in a generation. And keeping pace with technological development will be an important component of this bill. So issues around improving workers' predictable working hours or improvements to flexible working conditions, enhancing opportunities for job creation, discussions around skills, demand, and also debates around the right to disconnect have been part of these negotiations. And again, I think what we've seen is that other similar countries are following a similar approach when it comes to these different developments. But as we know, in order to scale up technological transformation in the UK, and as part of what the UK has called a Artificial Intelligence Opportunities Action Plan, basically the UK government unveiled an ambitious and novel approach to AI that aims to strengthen UK's global competitiveness in this particular area. And again, I think we've seen in all these different countries this type of is really trying to lead on this space, but well, as we know, this is far from being an easy task. So as I was mentioning, the government is committed to building a cutting-edge, secure and sustainable AI infrastructure. And this is important to highlight that it is both for public and private sectors. But when it comes to AI readiness, and as many of us know, scaling up doesn't happen from one day to another. So what I guess it is important for UK businesses not to be pressure into this sort of a hype to rapidly adopt and integrate AI-based systems. As we know, different sectors have different challenges. SMEs, smaller and medium-sized organizations, might also struggle when it comes to investing in this type of technology. So those are things that regulators really need to keep an eye on. And I think this is also important to highlight as many operational and organizational efforts around this type of technologies in the workplace are still lagging behind what was initially expected. And this is happening due to different issues and reasons. So it could be a cultural infrastructure, maybe economic and organizational barriers. I guess what is important to emphasize is that health and safety professionals can act as facilitators in overcoming some of these barriers, and especially when it comes to organizational barriers in the workplace. Also, and I think as Kelly has somehow disclosed during her introduction, any developments of this nature really need to be based on principles of safety, transparency, public engagement, and expert supervision. And as Kelly was mentioning, she mentioned risk assessment, of course, thorough assessments that take into account all the considerations and both positive and negative impacts. At IOSH, it is true that we believe that this is quite a unique chance, not just to boost growth, but also to create good quality of work. I think we've seen that conversation happening in the UK, that debate between like what good work and precarious work should looks like, but also prioritizing, as we were saying, like economic growth or competitiveness in the name of poorer like working conditions. Another important development that I think is worth highlighting, I think it was quite novel, is from a trade union perspective. And this is the artificial intelligence bill proposal by the Trade Union Congress, known in the UK as the TUC, that looks at ensuring that people are protected from the risks and harms of AI decision making in the workplace. The proposed bill, and I'll try to put some of these links later on through the chat function, also alerts of existing flaws of the UK legislative system in terms of transparency and explainability, a lack of protections against discriminatory algorithms, but also an imbalance of power over data. And again, I think this is something that to a certain extent is both happening in developing emerging countries and also like non-developing economies as such. Again, focusing on the risk-based approach, as Kelly was highlighting, it's quite interesting that the paper includes an obligation for employers to carry out our specific AI risk assessment of AI decision making, and this is to happen like pre and post deployment of these technologies, and also with a rolling 12-month review, which I think is something quite that health and safety professionals are quite familiarized with when it comes to like dynamic risk assessment. I think another relevant development I'd like to cover is more at the parliamentary level. So there's an all-party parliamentary group in the UK, tend to be known as APPGs. And these are basically informal cross-party groups formed by MPs who share a common interest in like one particular topic. So IOSH participates on a regular basis on one of these APPGs on the future of work, and this is basically a network that brings together parliamentarians, industry, and civil society to better understand the impacts of technology on work and society. And if we, I just produced one slide, so if we can move to the next slide, please. Yeah, so as this slide, well, it tries to reflect prioritizing good occupational safety and health as the foundation to developing and deploying technology. It's not something really new to IOSH. So for the past few years, we have been promoting, as Kelly was mentioning, a human-centric approach to AI-related developments that prioritizes human ethical responsibility. And I think we've been quite consistent with this viewpoint in the last decade. As part of the policy function at IOSH, we also consistently provide health and safety technical input, as many of you will be aware, to different UK and international consultations happening on this subject. We have also developed a policy position on digitalisation and IOSH that covers some of the calls for action when it comes to like governments, health and safety professionals, workers, employers, but also, for example, developers, of these technologies. And we also provide regular digital content and thought leadership through the production of articles, webinars, presentations, and so forth. So all these materials are freely available on our website, on the IOSH magazine, and also on our YouTube channel. We also support the work and campaigns from key stakeholders, such as the ILO, and we got Dr. Assi that she will be going through the campaign I was mentioning before, but also other stakeholders such as the European Agency for Safety and Health at Work as part of their two-year campaign on safe and healthy work in the digital age. And again, I will be placing these links on the chat later on. And finally, we also produce research, and so in April 2024, IOSH, together with Arab, launched a report towards a safe and healthy future of work. And basically, that report focused on how new technologies and digitalization are creating opportunities to improve how people are protected at work, but it was also focusing on the downs, let's say, of this type of technologies. And I think that this is all from me. Again, thanks a lot for this opportunity. I'll try to put some of the links that I've mentioned of reports and like different developments in the chat, and I really look forward to the presentations from the other speakers, and also I will stay in later for the Q&A session. Thanks again.
Thank you very much, Ivan. And yeah, the ARAT report, the future report, if you haven't read it, it prompts some very, very interesting questions around what the future of work looks like for all of us, and some of the questions that perhaps we should be asking ourselves. So it is now my pleasure, on behalf of the International Occupational Hygiene Association from Canada, to introduce Mwangi Ndonga to discuss the impact of digitalisation and AI on worker health. Over to you, Mwangi.
Can you guys hear me? Oh, good. Well, thanks for inviting me, Kelly. And thanks for ILO and IOSH for putting this webinar together. Like you said, Kelly, this is, this is uncharted territory, and so it's good that organizations are talking to each other, professionals are talking to each other, and so it's a pleasure for me to be here on behalf of the International Occupational Hygiene Association. We are a global community of occupational hygienists, and this year, in 2025, we're really focusing on strengthening and building productive partnerships. And overall, like you all on this call, we care about maintaining a health and safety environment, safe and healthy work environment. IO has 43 member organizations representing over 20,000 occupational hygienists. And if you're interested, we do have a volunteer working group that is focused on sensor technologies. So, my presentation today is, I'll be honest, I'll be speaking less so from a North American perspective, but what I want to do, I want to talk to you as a practitioner that's been challenged, and how I've taken on some of these challenges and maybe where I've messed up, right? So the perspective here would be maybe from a skilling perspective, and trying to be honest about maybe my journey, and we could talk about perhaps the recommendation is to go to the, and take an opposite journey than I have. So again, my name is Wongi. I'm based here. I'm actually based in the US, Kelly. Sorry, I should have told you guys that. But I've worked in Canada, US, and Mexico. So again, I'm not here to speak for those countries, but I could definitely give a perspective on when I've done what I've done, right, and how that's gone. So next slide, please. So these are the members for IOHA, in case you're interested, but we can chat later. Next slide, please. So, a few years ago, it's about 7 years ago, I was at work and I was hearing these folks talking about these fancy terms. They were talking about R, Python, packages, something, something, something. Didn't know what they were talking about, right? But after asking a few questions, what I realized is they were telling me about certain types of technologies that were giving them an advantage. These technologies were able to help them arrive at decisions, right? These technologies were doing the work for them, quote unquote, at night. And I asked myself, well, how come nobody's come to me? I'm health and safety. How come nobody's come to me and told me that these technologies exist? So I started asking questions, and I started asking myself, well, how come? Is it that somebody doesn't see me as valuable to be able to utilize this technology? So I there was this line, right? I asked myself, where do I go with the protection of my workers? At the time, I was an industrial hygienist for two countries, one person for two countries. Nothing against the specific company, but that's not rare, right? We're not, the number of health and safety practitioners worldwide, it's not like it's doubling, right? We're being asked to do more with less. So how can we utilize technology? How can we utilize things like AI, right? So what's the step, right? How do we go from a yellow, to and step forward? Next slide, please. So in North America, NIOSH has these future of work initiatives that we reference, right? Very similar to many of the things that Yvonne had actually showed. So the idea again is about how will the future of work impact the work, the workplace, and the workforce, right? If we think about the work, I think Manal, I saw some of her slides, so she might talk a little about organizational design, that maybe some job displacement, how work is arranged and how that will look, let's say in 30 or 40 years. Within the workplace, how is AI, things like robotics and technologies being used to enhance productivity, the production operations as well as safety? And then between the workforce, well, what does it mean in the future of work relative to demographics, right? We know we have an increasingly aging workforce, economic security, and like me, like what I want to talk to you about in this webinar is the skilling, right? What do we have to do, not just the workforce, but we ourselves, occupational health practitioners, what do we need to do to upskill? Uh, uh, and I want to quote my friend Emmanuel Carter, who reminds us, right, regardless of what we talk about, whether it's Industry 4.0, Occupational Hygiene 4.0, whatever, right? The occupational hygienist is still the smartest sensor in the room, right? Everything must be calibrated around that individual. They are the sun in our solar system. Next slide, please. So what I understood when I heard those terms from those people was that I needed to add vocabulary to my occupational health language. They were not necessarily interested in learning my language, right? As much as they may hurt my feelings. So how do I do that? First, I have to recognize that artificial intelligence is not born of occupational hygiene and safety. It's not our thing. We have to go out and learn about it. If people wanted to learn about Legionella, noise, other things, we author those things. We have the textbooks, but this is not our thing. So we have to adopt a new language. And as we adopted the language, we have to figure out how to promote our causes, right? Make those folks that have the tools understand why we want them. So you can see where I'm going with this is that we need to retool. So I'm not sitting here saying we have to throw everything, dump everything from the table and start over. I'm just saying retool, meaning there may be a tool that still stays in our toolbox, but there may be some tools that need to be sharpened or modified so we can continue marching on our journey forward. The other really good thing compared to 7 years ago when I was asking those questions is the AI literature has become way more accessible and trialing ideas is way more possible. If you were to Google, you have lots of AI assistants. If you want to understand what a KNN algorithm is, there's assistants that can really do a good job of explaining those things. And also, if you want to trial something, right, depending on your organization's tolerance to technology, you can trial many things, right? Very easy desktop experiments with lots of tools that are out there. Next slide, please. So coming back, what did I end up doing? Well, what I just told you, I started Googling things, right? I started asking those people that do this work, well, what do you think is a good resource for me? I started buying books, right? I started learning how to code. And eventually, I felt that I had enough vocabulary to pitch projects to data scientists. And so there are two projects I'd like to highlight that I was a part of. One, I used to work in the upstream oil and gas sector, and if you're not familiar in that sector, your workers have to wear what's called a four gas monitor. It's measuring toxic gases at all times to keep them safe. And today you have companies that have connected four gas monitors so you can see your workers. And I had an idea that perhaps we could use some of the data that we're collecting from those four gas monitors to understand exposures. Now, as an industrial hygienist, you may say, I want to sample for benzene. That's what I care about. But here we are sampling for explosive atmospheres. What can that tell us potentially about benzene? And so I accosted these data scientists. We got in a room for one day in front of a whiteboard. And at the end, they said, hey, we have an idea. We think the algorithm we want to use is called k-means. And I said, oh my God, I know what that is. Right. And then we worked out, right? So I understood the language. I can't necessarily code it out, right? But once we got it in front of the whiteboard and we're talking about So, defining our problem and potential solutions, we were winning. Another example, we were interested in extracting intelligence from incident descriptions. Now, when you and I get those incident reports, hopefully that not that many, when we get that report, we always go to the part that describes what happened. Wonky was walking over ice and slipped. When we read that as humans, that's a lot of intelligence. I'll be honest, less so those checkboxes that say, what time was it? We can't interpret that well. So we wanted the machine to extract these incident descriptions and tell us some information about hand injuries, okay? And we used one of our teammates to sift through the data, put some labels, teach the machine that, and the machine was able to do that. So in those two examples, one, taking technology that we're already using and saying, how can we stretch it out? Of course, ethically, right? But ask yourselves, what else can this tool also help me with that helps reduce risk? Number two, let's think about the mundane things that on a Monday morning, like this morning, you all going to get many emails. What is the thing that's keeping you at your desk that is stopping you from interacting with workers, stopping you from supporting your stakeholders? What are those things? And I think that's where AI should be first adopted. Next slide, please. So, I was just spitballing a few ideas on where we can take machine learning, at least I've seen. So some potential applications I feel we can go with. And I'm talking about small, right? Not huge, right? When it comes to supervised learning, I think, again, look at those mundane or repetitive tasks that are keeping away from your workers. Let's assign AI that, the boring stuff, okay? It's likely that the process problems, if I'm going to intervene with a worker about, let's say, an exposure. The exposure is probably coming from a process that's releasing something that probably shouldn't be released. So it's likely that those process problems are occupational hygiene problems. So can you tap into the process data and see where they can form risk, right? What's interesting about your maintenance data? Are your folks maintaining, are they going to fix equipment over and over and over again? That's a thing. That's data. Let it inform us, right? And I would even say more importantly, supervised learning can help you identify useless data. You may not want to say, but you may be collecting a bunch of useless data. That is, I was speaking with one of my friends, one of my colleagues in a past job, and I remember one of our incident management systems used to ask us to collect the wind speed for every incident. Well, okay, somebody would collect the wind speed, but over time we say, how is this relevant, right? So maybe something can tell you, yeah, this category you keep picking has no relevance, so hopefully supervised learning could do that. Next slide, please. I feel with unsupervised learning, I love using unsupervised learning myself because I kind of feel like it gives me a second opinion. So if you're an industrial hygienist with similar exposure groups, throw it at an unsupervised learning model, see what it says. Doesn't mean it's right. Doesn't mean it's right, but it's a second opinion, right? We hear, we talk about safety and reducing safety risks. I'm really passionate about recognizing the plants, the locations, the individuals, the teams that are doing very well with those tools you're giving to keep them safe. So can you use AI to recognize people, right? Because we know people should be motivated, need to be continually motivated to work safe. So I would love to use AI to help me pick out plant of the year, location of the year, safety person of the year. And finally, when I say here behavior of sensor connected workers, suppose you're curious about how well your new hire training is going, right? Is your new hire training and your folks who are newly on the job and supposedly equipped with what they need to do the job, is that happening? And so you can look at the behavior, not necessarily to say good or bad, but to look at your training program to see whether it's really being effective. Last slide, please. So here's the things for this community to consider, right? You can tell me if I'm wrong, you can IM me later. So we need to create this space for trial and error. Sometimes I hear a lot about return on investment. What about the return on investment in this project? You can't get to return on investment until you're trialing and experimenting, and then you have a case to go ask people for money. So let's not jump to ROI real quick because it's gonna feel like we can't start anywhere, right? Let's find little experiments that we can do and then take one case, then another case, then we can sit in front of our boardroom, in front of whoever, and ask for money, resources, and things like that. How clean and tidy are your data? I don't think we're there, folks. EHS. I don't think we have necessarily clean and tidy data to get to AI. If you give a model bad data, it's going to give you bad outputs. Let's start there. Okay, let's start there and talk about that. I would love for you all to advise students in school right now studying to be occupational health and safety professionals, and also advise those early career professionals, but also get out of their way. Please don't tell them that the way you've done it in the last 20 years is how they should do things, because the way the profession is going to look like, it's going to look radically different. So advise them, but also get out of their way. There's more to AI than ChatGPT. We all have ChatGPT, but coming back to our talking about data, if you're trying to build models, if you're trying to do supervised learning or anything like that, that is there's ways to getting there. So I know ChatGPT is the thing that we hear about a lot, but there's way more to AI than just ChatGPT. And let's not use ChatGPT as a distraction. Maybe that's my point. Can you explain this tech to a worker? If you cannot explain what you're doing to a worker, I think you need to start over. Not start over your project, but if you can't explain to a worker what it is you're doing with this fancy stuff, I think you need to pause, right? And practice. Because we have to tell the story. So my last point is this. We have to tell our AHS story. AI can help us do that. It can help us organize data. It can help us understand where we have gaps. But at the end of the day, you have to tell the story to your worker, to your board, right? To your organization, to your community. Learn how to tell the story because the technology will not tell the story for you. Last slide, please. So again, I really appreciate your time. If you're interested in IOHA, please go to their website. I'm thankful to Nancy for asking me to speak. If you'd like to chat with me, there's my LinkedIn connection. I'm happy to argue, support, debate, anything you'd like. Thank you all.
Thank you, Mwanga. I smiled quite a lot during that because there was an awful lot of it that I definitely recognized, that whole kind of us having to change and adapt our language to depending on the audience that we have. Also, Google being our friend very much. And I loved that element around so in IOSH, we have a mentoring scheme with our more experienced professionals supporting our new and emerging professionals. But we also have reverse mentoring for exactly the same reason of like actually my experience within, in the last 17 years of my professional career is considerably different. And there are definitely things that we can learn from our younger and more emerging kind of professionals as well. So thanks very much. Lots of food for thought on that one. And if you want to hear more from Mwanga on tech and EHS, you can find him on the podcast Probability Matters, which I will definitely be having a listen to after this. But now I would like to hand over to Mr. Hassan Mattar, who is a researcher. Hassan, over to you, please. Thank you.
Hello, good morning or afternoon or maybe evening. My name is Hassan Mattar. I'm a labor specialist in the Executive Bureau of the GCC Labor Ministers Council. It's my pleasure, distinguished participant, to be one of this small short community to share some of our good practices. I consider good practices of the GCC countries. First of all, we work together as a regional group in many different issues and a variety of issues of labor and social affairs and other common interests. Occupational safety is one of these common or joint tasks we work together on. Please, the first slide, if you could please. Yes, just give you a quick glance. It's a glance of GCC has a long standing of working on OSH. I could give some very historical overview that First, about the nature of the labor markets in GCC. This is GCC heavily recruiting from Asia, South of Asia, and East of Asia, especially workers in the low-skilled workers and in constructions, in the public works. These are the nature of the GCC recruitment channels. We are heavily depending on sending countries like India, Pakistan, and the Philippines, and a lot of these these countries there. So one of the main features of the GCC that we are keeping pace with the anything updated in the realm of OSH, and we could say that we have good practices and we share it. We share it from every second day. For example, we have a smart inspection. We have workers' accommodation standards that applied. And if you could please go to the next slide. Yes, this is a historical overview and or background of what we have done since the late or since the last century, the late last century. So we have GCC consolidated principles and framework for advancing education and training in occupational safety and health. This is in 1990, we have then we establish guidelines on OSH, and then we have like a model of an executive order. Then the last and the most important thing that was the latest one, and this is what we are relying on for the next stages or the coming days. This is what we call GCC framework on OSH. It's adopted last April, and one of the principles in this framework about the utilization and enhancement of AI in occupational safety and health. And we have a wide range of studies, also meetings, workshops, and events in OSH. So we could, but since this meeting is about the utilization of utilization of AI in the occupational safety and health, we may share some of the information we collected from our stakeholders, I mean GCC countries. Next slide, please. Next slide. Yes. Okay. No. Before going through the AI. Okay. Yes. These are yes. These are the main functions of AI that is used in by companies or by the inspectorates in GCC. For example, what the goals is, for example, reducing costs of monitoring occupational safety and health risk, identifying when workers, those non-compliant workers, and enabling faster reporting, protection from injuries, and detecting or predicting hazards and incidents. These are the main goals of the usage or the utilization of AI. Next, please. Yes. These are examples that you asked us to share and give some idea about what we are doing, because there are many examples that are used either by administration, by government administrations, or by the companies themselves, especially big companies or enterprises. For example, in United Arab Emirates, first of all, I could say that the much of the information we collected are is about the analysis. The Gulf Cooperation Council countries use the AI, using AI, they use the AI to analyze data related to occupational health and safety. This is the most shared or the most common feature of using AI, analysis of data. For example, in the United Arab Emirates, they used AI in the analysis of big data in construction industry to develop health care services through monitoring heart rates, diagnosing dementia, predicting hospital admissions, and forecasting mortality risk. In Bahrain also, artificial intelligence is used to prevent accidents in oil sector. In Saudi Arabia also, they are, by the way, there are many wearable devices are used that should be there beforehand. So in Saudi Arabia, they also use the data to identify AI they use AI to analyze data to identify patterns that lead to accidents. Next, please. Next slide, please. Yes, we have also Oman. They also analyze data to improve inspection processes, and there are facilities that or inspect facilities that might endanger the safety and health of workers. In Qatar, they use AI to improve inspection process by analyzing data and identifying higher risk locations to guide inspectors more effectively. Also in Kuwait, they use this kind of program or technical program of AI to analyze feeds of cameras, because the cameras are set up in working sites, so they are used these feeds of the camera to detect misuse of equipment, blocked emergency exits, and unsafe behaviors of workers. And this information I saw that are already some of them are I found them in the ILO report that was published in the late April, last April, under the title Revolutionizing and digitalization of AI and digitalization. This is some of these good practices are already there and somewhere else in the world, and I'm happy that these are one of the brilliant examples that we have here in GCC. And I think this is the last slide, or there is it. Thank you for attention, and thank you for my speech because I have just arrived home from work and I'm a bit tired. Thank you, and thank you for your attention again.
Thank you very much, Hassan. And we appreciate kind of having had a long day of work and then attending something like this, but thank you very much for sharing. So finally, I am absolutely delighted to introduce Dr. Manal Aziz, who currently heads up the global team on occupational safety and health, so OSH policy, at the International Labour Organization, affectionately known as the ILO, based in Geneva, Switzerland. Over to you, Manal. I think you're still on mute.
Yes. Thank you so much, Kelly, and thank you to all the speakers. It's such an honor to join you on this discussion and to listen to other colleagues who've given so many different experiences from their regional and national perspective. It was good to hear from IOSH and IOHA and from the GCC example as well. And unfortunately, we're missing some colleagues also to see more perspective. But I mean, that was a bit the aim of the global report that the ILO launched just a couple of weeks ago in the context of the World Day for Safety and Health at Work. And it was interesting to hear some of the applications, and that, you know, for safety and health, it's a lot about how we collect data and how we access data to inform prevention and to understand risks and take action. And so we also, when we were doing the research, built a lot on the research done by the European Occupational Safety and Health Agency that have been running a campaign on digitalisation. Also, I hear our report's title is very difficult to pronounce for many people. Like, did you really have to say revolutionizing digitalisation? It's really long and annoying to pronounce, but it was exactly the point. We wanted to make sure that we give a positive spin to the discussion. So it's not only about, you know, new risks, we're losing jobs, AI is taking over. It was more about, let's take a minute to recognize what you know, robots have taken over, what automation has actually saved us from, and how many lives and injuries we've been saved from by the introduction of something, before we, you know, dive into the problems that we are facing. And as some of our occupational health colleagues, it was also a new topic for all of us. And, you know, when you understand a bit about science or hygiene or health, and now suddenly we all have to become experts on technology. And we also have to make others in our work environments understand that there's a role for safety and health when you introduce this technology into our work environments. And yes, it will affect the safety and health of people. And we need to now understand this technology and see either how best to use it or how to prevent the new risks. And if we were to sort of summarize or group the issues and how this is impacting OSH, we realized that these 5 areas were the main areas, and it was about how technology has helped to automate some of the jobs and tasks, and how robots have been, you know, removing people from highly hazardous environments. Also, the increased use of smart tools. These have been around sometimes, some of them for decades, you know, from video systems. But today we have AI-powered video systems that are more powerful and more knowing and more informative to meet their objectives. We also have the use of virtual reality, especially for training, in terms of immersive training in highly hazardous jobs that can save people from being trained in more hazardous environments. But again, this technology has allowed for new forms of work, including the way we manage work, algorithmic management, but also telework and online work, and you know, the good things that come with that, and the negatives. So we looked at these 5 areas, again, to sort of, as you know, as a chapeau to the discussion, is to say, yes, you know, millions of jobs are not necessarily lost, just changed, transformed. And we have new data coming out 20 May from our research department that again re-emphasizes the fact that people aren't losing their jobs in a vacuum. It's more millions of jobs and roles and tasks are transformed, but hundreds of millions are being empowered and enhanced by the use of these technologies. It is a question of being able to reskill, to upskill the workforce so that everyone continues to have a role. And it is a question of continuing to have humans at the center of this discussion because, you know, robots are not going to function alone. New jobs are being created if we're talking about data annotators and people behind the production of AI being exposed to new risks. But also we need to keep in mind the whole supply chain for providing these technologies, from extraction processes in sometimes very developing countries. And these workers are exposed to hazardous conditions of work when extracting the minerals that actually power this technology, to the people behind the screens creating this big data, to the electronic waste management, where, you know, a lot of these different electronic products and equipment are being thrown in situations, and the waste management in highly, you know, developing countries for workers that are exposed to hazardous chemicals, toxic substances without the right protections. So it was important to understand the bigger picture and not just what's happening at certain, you know, straightforward workplaces and in certain sectors such as construction, mining, and other sectors, but also to complete the picture of the sort of pros and cons of these changes. I know I have 10 minutes. The presentation is quite long, and I think it will be made available to our participants. The full report also will be made available. It is already online in many languages, and it has a lot of examples and details. But the way it's structured is discussing now automation robotics with some of the positives and then some of the risks pertaining to all of these risks, but also some of the risks pertaining to all these technologies, but also some policy level responses and strategies that have been adapted to align with these new risks, and some workplace level risk assessment examples of how they have also evolved in line with these new technologies. So if we're just talking about advanced robotics, we know that, you know, they can work, these robots, in high temperatures. Also, drones can access confined spaces where workers cannot go to conduct certain jobs. We know that as exoskeletons are supposed to help workers from certain musculoskeletal diseases, prevent that, and from certain strains that we put on our bodies. And also there are so many repetitive tasks. They could be administrative or other in production processes that can be taken over by more automated processes, and that will allow workers to do something more challenging, more interactive, more creative than some of these tasks. So it could be seen in that positive light. And these are some examples. For example, drones in agriculture have been used to spray hazardous pesticides, preventing that workers are exposed to this process. If we look, you know, robots have removed heavy lifting. For example, they can deal with radioactive waste that we don't want workers exposed to. And so they're a bit, you know, those are some of the examples of where we find robots doing some of the jobs that we don't advise, you know, that humans can continue to do. Of course, there are risks. There are safety risks. We're talking about systems that can malfunction. We're talking about human-robot interaction that needs to be also controlled. You know, exoskeletons, if they're not adapted to the body of the worker or to the size, the height, the gender, they can cause more problems than actually save. People keeping pace with a lot of these machines and trying to control all of these sources of work processes can lead to stress and cognitive overload, and sometimes we feel like we're lacking autonomy on our work. And of course, certain groups of workers can be isolated in different ways, but also cannot have access to these robots and automation processes. So, there's a question of resources, there's a question of having the right skills to manipulate some of these technologies. For smart tools, we've seen them everywhere. I mean, they've been discussed also from previous panelists. We have all kinds of sensors and AI-driven systems and smart wearables. On construction sites, these smart wearables can actually detect falls from height. And sometimes they're even linked to medical teams that can come on site and prevent a worse outcome, even if the worker, let's say, falls from height. With the team being there on time, this can prevent, from the situation becoming more serious and catastrophic. They can also detect posture. They can nudge positively for people to take breaks. We heard a lot about also personal protective equipment that already are, have sensors for toxic gases in mining, or ear defenders that can actually detect noise levels and, order, sort of request that the worker stops working at a certain noise level. And, not to mention in healthcare, they can take over some of the, more repetitive or mundane tasks, like taking vital signs and or doing some diagnostic testing to prevent from infection for healthcare workers, but also allowing the healthcare worker to take more time with the patient, to speak, to do more complex tasks rather than just, noting down vital signs and others. So they've been, adding value in many sectors, as we can see. And here are some examples of what I mentioned, including the AI-powered video cameras that can detect, for logistics and for transport workers and long-haul drivers to stay awake and to prevent further traffic accidents, etc. Of course, the new risks, as with the other situation, could be extreme surveillance. So if we use these monitoring devices to detect hazards in real time, they could be also used to detect production outputs. So so workers are feeling more pressure to produce within the hour a certain amount of outputs and products, rather than actually using it to ask workers to take breaks. It's being, rushing workers to increase their pace of delivery, could be another use. Again, we have a lot of access to data, and there could be confidentiality and privacy considerations. And so there's a lot of ethical concern about the invasiveness of some of these tools if they're not regulated or introduced properly with proper training and proper understanding of the real need for them. Virtual training, as I mentioned, is really useful if you think of firefighters, for example. Instead of training in situations where they're exposed to fire, foam, fumes, and dust, they can, through virtual, very immersive training, where they're even wearing their proper proper clothing for firefighting, and put in such a realistic environment that is completely safe, has proved to be quite good for training purposes, and it's being used globally. With some examples, again, there could be some risks. And what I found, I mean, when we were doing the research, there's not enough data. There's not enough data about the trends and direct prevalence of the use of some of these technologies, and then the direct link with the increase or decrease in injury and diseases. So it would be interesting to invest a little bit more on the use of some of these technologies across countries, across regions, across sectors, and different workplaces, to see the uptake and to measure the change in trend or not, in the rise of injuries or their decrease due to these technologies. Again, algorithmic management of work is a tricky one because, yes, sometimes it allows us to detect patterns. We can see the preferences of workers, and we can even add gamification options to sort of provide rewarding and incentive for workers. At the same time, again, it is quite an invasive form of management of work with access to a lot of data, and there's no human interaction sometimes, and so you can't get a full and meaningful understanding of the workers' needs through the algorithmic management of work. And there needs to always be, a human operator behind all of these technologies to continue to be mindful of the new risks that may be posed by algorithmic management, such as those that are organizational in nature and psychosocial, even ergonomic, due to the need to be connected and the sedentary type of work that this would entail, and the reliance on computers and internet that would lead to even a rise in cybersecurity and breaches that we're seeing also globally. This is just an example of a study and the impact. And here what it shows really, if participants are reading, it's that it's not always the technology or that's the problem. It's really how is it being implemented, used, how is it being regulated that can serve as a positive or negative addition to our workforce. Changing work arrangements and teleworking, platform work, gig workers, all these workers, while this flexibility in work has allowed for people, for example, with disabilities to access the labor market, it's allowed people with caregiving responsibilities, whether for children or elderly, it's allowed them to access the labor market from their homes, from different workspaces. It brings with it challenges. It brings with it risks. Again, we cannot control the work environment outside of the traditional workplaces, and a lot of training needs to come with that, a lot of understanding of what safety and health risks. There's blurred lines between, personal lives and work lives, and, there's discussion of domestic violence, of so many different ways that the overlap between working from home and working, from a specific workplace that is outside of the control sometimes, and the duty of care, in a sense, of the employer, the manager. So a lot of work needs to be invested there to make sure that we can provide the same kind of conditions and protections that workers in traditional workplaces can access. So that's a whole discussion within itself. So this slide sort of summarizes both for each of these 5 areas, both the risks and the potential to add something very positive to our workplaces from these technologies. And so I think it's a really good slide that summarizes what I've just said. And again, we need to think of people powering AI, like I mentioned, from data annotators to content moderators to machine learning engineers to big data analysts that are exposed to sometimes very annoying content that they need to screen through. And they also need to be, doing this on hours long end. And, their safety and health should be considered as well to actually power all of this, not to mention what I talked about earlier, from extracting critical minerals to make these technology available, and then from assembling it to the waste that is produced from this technology. Is always something for safety and health specialists, and from a more global perspective, that we need to consider when we're discussing. But this is happening. It's not like we can stop this process, but we need to be very aware of what we can do to make it as a positive change as possible. Again, the ILO's fundamental conventions are very important in this respect. and apply. So if you're looking at the 2 ILO conventions that have become fundamental in the last 2 years, their principles and rights are somehow obligatory today, whether countries have ratified these conventions or not, the 2 main ones. And 155 clearly identifies and clearly articulates the need to ensure that new technologies are safe and do not pose health risks, and that adequate training and information for workers as new digital technologies are being introduced is given to workers. And then Convention 187 complements these ideas by providing the OSH framework to implement all this, calling on the need to collaborate between governments, employers, and workers to ensure that these technologies are being used for preventive measures. And this collaboration, of course, does not only include workers, employers, and governments, but should also, speak to research institutes, to academics, and everyone around us. As more and more safety and health is becoming multidisciplinary, more and more we need to speak so many different languages in this space, so that we keep up with the evolving nature of risks. So it was important to note that some of our fundamental conventions remain relevant and applicable as we navigate these changes. And some future standards are discussed in the report, such as these, and global initiatives are out there, even from employers and workers and institutions around the world. The European Union as one of the progressive regions where we get good examples is also there and developed more in the report, including the campaign of EU OSHA that I mentioned, Safe and Healthy Work in the Digital Age, that's coming to its end this year. And so many different examples here. But if I move to the national frameworks, we see here different regulations and some examples of what that looks like. So if today we say, new risks may be generated because of this technology, we need to be able to say what kind of regulation can apply to buffer from this change. And here you can see from Argentina to Finland to Uruguay how certain regulations are being updated to introduce these technologies, keeping in mind the protections that need to come with these changes. And some are really on human-robot interaction, some on the right to disconnect, that workers have the right to disconnect, some on managing and regulating the digital platform and telework. The ILO is currently in a standard setting discussion starting this June and next June on promoting decent work in the platform economy. And there's a huge occupational safety and health section there that we're following. And hopefully a new instrument, a normative instrument, will be adopted in June 2026 that can provide more global policy guidance on management of safety and health in the platform economy. There are here some examples of collective bargaining agreements and the role of labor inspection. And we heard earlier from different speakers that labor inspection bodies have been using these AI-powered systems and data methods to collect more data on recording notification of accidents, diseases, and other potential violations, or for training purposes. And here are some examples of voluntary standards and technical guidelines. So a lot has already been done. Robots are not new. Automation is not new. It was just to group all of these issues that keep evolving and sometimes at a very rapid rate and affecting every sector today and every country. We had countries when we started saying we're going to do World Day on this topic, they're like, oh, but that doesn't concern Congo and it's not going to concern this and this country. But it's affecting every country. We just got so used to it. So we use these sometimes sensors and devices that are thinking like, oh yeah. Or some people still think a lot of these are futuristic, but they're not. You just suddenly they creep on you and they're part of your work, but you don't necessarily defining them as such. And so this report was just to make us more aware of, that these are happening, they're around us, how are we using them, and let's be aware what our role is to protect workers from certain risks that come from them. Here are some training programs, and then also different at the workplace level, what can be done, what institutes are doing to support the automation and their impact on safety and health, and different studies and research that's being done around the world. And again, the occupational safety and health management system at the workplace, what does it mean to look at the hierarchy of controls from the perspective of these introduction of these technologies? And here we see how, we have to apply our policy adaptation and organizing and evaluating in that respect. But also here are some examples of what does it mean, to apply the concept of elimination, substitution. What are engineering controls when it comes to real-time monitoring systems? What is, what does elimination mean of a hazard when today, you can replace the task with robotic systems and drones? And then what is the role of personal protective equipment if they can have a more proactive role in detecting hazards as well? So it's a very wealthy and rich discussion, and with a lot of detail, and we go into some of that in the report. But I think the report is a conversation starter. It touches upon many issues. It tries to organize our thoughts on what we're talking about when we talk about AI for work and AI for OSH. What does that mean? It's the trendy word now, but it has so many different connotations when it comes to safety and health, and we need to bring it back to the OSH management system and bring it back to the hierarchy of prevention that we follow. Again, so this is a summary of the takeaways for the 5 areas. Like I mentioned, they're proving to be very positive in many respects, but our role as OSH practitioners is to make sure we prevent further risks that may come with them. So thanks so much. I hope I didn't take too much of the time, and happy to have the question and answer.
Thank you very much, Manal. We've got so many questions that have been coming through, so I'm hoping that we do get time to answer as many of them as possible. So thank you, and not only to you, but all of our speakers, and to our audience who've listened rather intently for over an hour now. I really do hope you found it interesting. And thank you to those that have already put their questions in the Q&A box. I am going to remind you to not put them in the chat box. They get missed, they get moved as the chat moves on. So if you do want your questions answered, please try and get them in the Q&A rather than the chat. If we don't get time, because we've only got 15 minutes now. So if we don't get a chance to answer your question, we will endeavour to follow up directly with you with any questions that we are unable to answer afterwards. So first and foremost, how do factors, and this is for any of the panel to answer, but I'm going to ask you to keep them short, please. How do factors such as economic development, industry focus, and government policies shape the adoption of digital safety technologies? If anybody wants to answer that one. Don't all jump at once.
I can't speak to policy, but
Great.
I think there's some questions, Kelly, I saw in the chat around risks, right? Like maybe which industries and things like that. So again, working in industry, yes, we're looking at a risky operation or a person in a risky, situation. That overall risk can affect operations. So sorry if I'm talking about from an operational perspective,
That's
but
fine.
if a person's injured, that stops the line, which stops production, right?
Yeah.
So what I'm saying is, so it is, if you're having a conversation, regarding starting with risk, that's where you want to go. Now, what happens with policy, that's beyond me, but I can tell you we are focused on risk all the time. And like I said, whether it's machinery or the worker, but if all that can be reduced, and folks can go home.
And fundamentally,
Healthy.
that's what it's about, isn't it? We want people to go home at the end of every day of work. And if we can use this kind of technology to help us do that, like that's not necessarily a bad thing. We've got a question from our audience around the ethical considerations regarding like AI surveillance for workforce safety monitoring, and I'd love to hear kind of all 4 of your thoughts on that one, because I think that's often the crux of it, isn't it? It's that the ethics behind it as well.
If I may jump in.
Absolutely, Ivan.
Just to try to cover somehow both questions. I think it is true, and I mentioned that during my intervention, that we've seen this imbalance, I would probably say, when we're talking about efficiency, competitiveness, innovation, and economic growth. And of course, health and safety must be seen as a facilitator when it comes to those processes, but we don't have to forget that there's always like a human aspect when it comes to this technology. So I think that's part of our role and our narrative. I think in terms of the downs, we've mentioned those. Workplace monitoring and surveillance, I think is one of those areas that I guess it really concerns, us all. So here we're talking about real-time monitoring of progress, or things like performance monitoring or time tracking. And I guess for some particular sectors, this is quite challenging, especially because they are quite associated to performance and so on. So I guess again, it's just a matter of putting in balance those improvements and developments, but also the human aspect as well.
Hassan, have you got any thoughts on that one?
Let's see. I'm so sorry. Yes, say. Could you repeat the question? I think
yeah, we're having a conversation around the kind of ethical, like the ethics around kind of worker surveillance and using AI as a tool to monitor our people. And although the intention is obviously we put in worker surveillance to look after them and make sure that we're supporting them, but what's that? There are other ethical considerations. So, what are your thoughts around that?
Well, in GCC, as far as I know, there is no legislation dealing with this ethical issue. This is an ethical issue by surveillance by technology, and I think this would be one of the topics that will be covered in the next meetings of the next joint meetings of GCC. In terms of limitation of using technologies to supervise or monitor workers, and because there is no single legislation, as far as I know, to prohibit or to regulate this kind of stuff.
Yeah, and I think it is very much that element, isn't it, of like AI is here to stay. These kind of monitoring surveillance, this kind of monitoring is here to stay, and it's becoming part of our toolkit, isn't it? I suppose part of it is, one of the things that Manal kind of referred to is that there's countries that do have legislation in place or are looking at implementing legislation, and there's always the potential. I always talk about health and safety as being a team sport, and it is very much that case of actually let's learn from each other. Let's learn, let's share. Like these are the best bits of legislation from around the world that are already out there, which I think is definitely one way of being able to do that. I'm not going to answer that one. Sorry, hang on. They keep coming. These questions keep coming, which is brilliant. And we've only got a few minutes left. I suppose we've kind of already answered the question around what is your view that the introduction of AI into certain industries and sectors will ultimately face a higher risk of job loss through aspects such as increased automation. Anybody want to jump in on that one with any of their thoughts? Go for it, Manal.
Building on also the previous question, so when we're talking about ethical considerations, and it's a lot about transparency and communication. So if there are policies in place to ensure that employers, managers, decision makers follow a full transparency policy when it comes to introducing these technologies into the data being gathered, to the limitations and the red lines between, you know, what data we can access and what we can't access, and then to communicating the purpose of gathering data. Again, also this was discussed by colleagues, is like, you know, data is data, but then if, you know, if it's not serving a certain objective, where is it going? I mean, and I imagine wind speed would be to probably add on to humidity and to understand the excessive heat exposure at work, or so. I mean, there are sometimes parameters that are being measured that, you know, we don't necessarily understand why, and part of that discussion is involving workers and their representatives from initial stages of design, of buying and introducing technologies. And when you get that buy-in from the beginning and you understand why we're getting a technology, you avoid a lot of these. And that's part of that's what needs to be that is what's being regulated at the national level in law and in practice, in regulations, is the need, you know, what kind of information you need to give the worker, and what kind of explanation and training and competency building when you're introducing. And for the other question, as I mentioned earlier, from the research the ILO is doing, and from there was a report that was published last year and the one before, and there's one coming out now in a week, 20 May. Please follow and you will see some of the most updated statistics. It continues to say that it's not that jobs are lost in absolute, it's that just a lot of roles and tasks are being transformed and changing. And again, we don't want to put the burden on the worker to keep skilling and upskilling, and people are at the end of their careers, but I mean, we've all gone through transition periods from, you know, not, you know, typing on a typewriter to having to use a computer. I'm one of those people. This is the new revolution, and we need to make sure that social protection considerations, working condition considerations don't fall as we go through this new revolution. And this is what we're here to safeguard. This is what we're here to safeguard as, you know, ILO and its constituents, its employer worker representatives globally, the ministries of labor globally. And these are the values and principles that we need to continue to voice so that they're not forgotten as we have this race to just produce more, do more, and you know, so that the worker doesn't just become a commodity but continues to be the main asset you have in your workforce. So this is how this research shows it, and we have to recognize that AI is empowering and enhancing jobs in hundreds of millions, as compared to the millions that have changed, hundreds of millions. So this is the proportion are being made better for workers. It's just that we all, you know, we need to keep up to date as this evolution continues.
It's absolutely, it's one of those things, like one of my presidential themes this year is around working at height, and, you know, working at height, falls from height killed more people than in war zones last year. And the ability for us to use technology to be able to eliminate some of that working from height means that more people get to go home. And there is always that balance, isn't there? It reminds me, there's you know, from the typewriter to the computer, and then just how, you know, and from the original, you know, mobile phones to the smartphones that we now, you know, the mini computers that we now carry in our pockets, and like that, that evolution is always going to be happening. And I think it's a fair reflection that it's not that we're losing jobs, those jobs are shifting. And that's not necessarily a bad thing, I don't think. Mwangi, have you got anything you would like to add to that one before I wrap
think you're
up?
reducing risk. So if somebody's doing something very risky and we can engineer it out. So so the task will go away. That's exactly what we want, right?
Yes.
Whether their job gets eliminated, so they'll reskill, but we are all interested in reducing risk. If that person is working at height today with no fall protection, and that's the way it's then that task has to be eliminated. We have to find a way of doing it, right? Or definitely reduce that risk.
Absolutely.
And as we can see, for example, in the construction sector, you were mentioning falls from heights, covering that whole cycle. So in the construction sector, I guess we tend to talk about prevention through design approaches, especially when it comes to designing, I mean, different infrastructure and so on. And that's where the technology can definitely help. But I think what we're saying that also, like, health and safety professionals need to be also familiarized with what is happening at the final stage of implementation when it comes to some technologies.
Couldn't have summarized it better, Ivan, and I think that's a really great place for us to stop, not only because we've also run out of time. I feel like we could continue this conversation for an awful lot longer. There is so much to learn, and health and safety, we need, as health and safety professionals, we really do need to be at the core of those kind of decision-making elements that our businesses are making. But we also need to educate ourselves in the AI and the technology that is out there and has the potential to manage risk and to make sure that more people get to go home at the end of every day of work. So thank you very much to all of our panelists. Thank you to our audience. The recording will be made available on the IOSH YouTube channel later on in the week. And whatever questions, there are a plethora of questions that we just did not get a chance to answer, and we will try and answer those directly as best as we can. If you have any, I've already linked it. I've already connected with Mwangi on LinkedIn. I will absolutely be listening to that podcast. But yeah, definitely have a read of the IOSH report if you have yet to do so. Go and look out for the new report coming from the ILO on, was it the May the 22nd?
20, yeah.
May the 20th, 2 days out. But yeah, thank you all very much. There is a feedback form that will have popped up a couple of minutes ago. Please feel free to provide us any feedback. And that is it from us and this webinar. So look after yourselves and each other. Thank you, everyone.
Thank you. Bye-bye.
Everyone.